with lumbar rotation.
Talking about midterm.
L4 right rotation restriction, L5 left rotation restriction, that would be lower. And then like L2 or 3 it would be middle, and then L1 would be upper. And really what I'm looking for is not that you know your rights and your lefts, although I would hope that you can work through figuring out rights and lefts. But mostly that the setup looks really good. So if you set up a left rotation and the card said right rotation, I don't care that much. I just want to make sure that it looked like you were getting the tension at the level you're supposed to get it at, and using all the things that we've been working on the last few weeks to get that positioning as good as possible. And then I want to see a thrust. And you can let off a little bit of tension to do that if your partner wants to do that. But I do want to see that all put together and culminate with thrust. But I'm really focusing on the setup to make sure that that is as good as you could possibly get. The thrust, you can fudge the thrust if the setup's really good. You can't really do the other way around. There's going to be PIs and ASs on there. There's going to be sacral torsion on there. There's going to be a PIR for what we just did, hip extension and then knee extension for the hamstrings. There's going to be PIRs for ASs and PIs. There's no real good PIR for sacral torsion. That's why we don't show you one, because it would be a very confusing thing to do with patients. The PIRs for ASs and PIs are basically just set up like you're going to manipulate and just do contract relax like we did a couple weeks ago. If I ask you to assess, the SI joint assessment card is going to be a lot of talking. So like, how would you assess an SI joint? You'd say, well, first I'd want to see if it's restricted, and I'd do the forward bend test, maybe the standing, the step test. So it's going to be a lot more talking than actually doing. Lumbars, I might just say, show me how you would assess for lumbar joint restriction. Because it's to figure out that SI joints are restricted and then to figure out what you need to adjust, there's a lot of steps there. For lumbars, we've already decided that we're looking for lumbar joint restriction, then we just find the stiffness. And then you can show me exactly what we've been talking about, active range of motion, passive range of motion, or segmental range of motion where we're palpating with our thumbs. And I want to see a number of different strategies to determine if there's joint restriction, not just prone, push on SPs. So push on SPs maybe, push on both sides, move it around a little bit. Definitely start out with active range of motion if I ask you to do that. The reason we're going to be talking through the SI joint stuff is because there's a lot of stuff to go through, and it would just be a much longer station than is needed. Once you talk through a lot of the functional things, I still want you to palpate for PIs and ASs and show me how you do that, or show me how you palpate for a sacral torsion. But I'm pretty sure that you're all good there. I've seen you the last few weeks be able to do that pretty easily with the static palpation stuff. But I still want to see it. As far as other assessment, that's it. Yeah, that's it. We're going to do more when we get to especially like cervical spine. We're going to do more strain, counter strain in there. You can do it for the lumbopelvic area, but PIRs tend to work really well. So we'll do more of that when we get to the cervical spine area after the midterm. So that's not going to be on this one. We didn't go over it in class either. Anything else? You have a question about they think I'm missing?
Do we just show up with a partner, or do you?
Show up with a partner.
Okay.
I'll have you sign up right before the class. Not too early, obviously. I'm not going to show up at 5 in the morning, but I'll be here right before class. And you'll sign in pairs. And I'll just go in sequence. The first pair will go, and then when they're done, the second pair will go, and we'll just work on down that.
Okay.
And we can put a couple things on.
You want to start at 9? So it doesn't take that long.
And
Boo.
He's thinking about it.
what's that?
He's.
I'm not
You're
thinking
thinking about it
No,
now.
that's not gonna happen.
You don't believe in sleep.
8 o'clock.
8 o'clock. That's it, right? Any questions? Again, I mean, the details like rights and lefts and stuff like that, I'm not too worried about. I'm mostly worried about positioning. I mean, the way you find joint restrictions is you just kind of decide like, oh, this is stiff here, I'm going to set it up to make it not stiff. You don't necessarily have to be like, well, that's a right rotation restriction. This is exactly how you set up a right rotation restriction. I want you to put the position together with the stiffness rather than exactly the motion it is. Even though most of the time you do that in your head anyway. But like especially cervical spine, when we get in there, you're just gonna find a restriction and fix it. And then you call it what it is afterwards, usually. That's the way that you should be doing it. I mean, rather than find it and write it down, write rotation restriction up. Adjust it. Oh, I adjusted it well. I saw the chart the other day. There were like 5 restrictions that they should have in another shift. And in the plan, they wrote attempted to adjust L4. Attempted to adjust. And I was like, why would you even, I mean, did you do it or not do it? Were you like, I'm just not comfortable doing it, I'm not gonna do this. And you either set it up and you dropped or you didn't. So, there'll be no attempting. That was like the, I'm gonna try to do it. I never want to hear that. Because you're giving yourself an out. I want you to do it. Get all Yoda on you. All right, any questions about the midterm? It'll be good. You'll learn some
If we
stuff.
have
I
other
give
thi-
feedback.
If we have other things come up between now and then as we review, can we email you? Is that okay? Cool.
That's right. Even if nothing comes up, send me an email. I might not respond to it.